here today. Thanks, Julius, for joining us.
Regent Park community health workers rally for fair wages. A strike deadline looms.
Senior management has turned this workplace into an unsafe and toxic work environment.
Ahead of an imminent strike deadline on Friday, March 22nd, Regent Park Community Health Center workers rallied Tuesday, March 19th, with a crowd of community members and allies to demand a fair deal for workers and the patients they support. These community health workers, members of OPSEU SEFPO Local 5115, provide critical services and programs for people in the Regent Park and surrounding communities, including life-saving overdose prevention programs, low barrier support for addictions and homelessness, primary health care, and much more under one roof. Talks broke down after 4 months of bargaining when the employer refused to negotiate a deal that would put patients and workers first. But after 30 years of frozen benefits, the workers are standing firm in their demands for improved wages and benefits and an internal work environment that is healthy and psychologically safe. OPSEU SEFPO Local 5115 Local President Kirsty Millwood says it's not too late for the employer to avoid a strike by coming to the table with a deal that includes fair, competitive compensation. Kirsty Millwood claims that they provide vital services to the Regent Park community, but they're facing a recruitment and retention crisis. Without fair compensation and healthy working conditions, the crisis in patient care will only get worse, said Millwood.
So many of our workers have been suffering burnout throughout the whole pandemic and with workplace stress. So we're looking to enhance the mental health hazards and reduce stress in the workplace for our members. We are also looking at wages that are just not keeping up with the cost of living crisis. We have workers that do not live in the city because they cannot afford to live in the city. And we have a benefit package that has not been increased for 30 years and is not keeping up with the cost of private sector fee-for-service providers. So we have a huge issue with recruitment and retention at Regent Park Health Centre. In 2022, we had a 22% turnover of staff, and in 2023, a 15% turnover, and this is unprecedented. From the management, we're asking for respect. We want them to come to the table and give us a fair and respectful deal. From our community members, we want them to come out on Tuesday to our rally and show their support. We have a digital action they can also participate in as well. We need the community support, we need the public support behind us so we can get a fair deal for our workers. We have an imminent strike date of March 22nd if we don't get a deal done right now. So it's crucial to get public pressure and public support in our community, and also for our community members to know what is going on. This will have a significant impact on them if we have to take strike action.
Local 5115 is part of the OPSEU SEFPO community healthcare professional sector, representing more than 4,000 community healthcare professionals across Ontario.
We mean business. You see the weather out here and we're here? Many more of us is to come. When healthcare workers are under attack, what do we do? Healthcare workers are under attack, what do we do?
Regent Park TV was at the rally to know more about the Regent Park Community Health Center workers' demands.
New management positions and title promotions. We have recruitment and retention issues, 22%, 15% in the last 2 years, the turnover. This leads to understaffed, overworked teams and impacts client access to care. Fair competitive compensation and healthy work conditions go a long way to increase the talent pool, recruit and retain workers with specialised skills that we need for our community. Workers are the foundations of this vital community. We're dedicated to Regent Park. We have many workers who have worked here for 10, 20, 30 plus years. If that's not commitment, I don't know what is. Our workers are real people with real life experiences and so much to bring to this community. We demand transparency, we demand respect, and we demand a fair deal. And on that note, I would like to introduce our first speaker today, a long-time activist and Labor educator. Their leadership centred on anti-racism and anti-oppressive framework, strengthening union democracy, creating inclusive union culture, deepening our connections with the greater Labor movement, which you can see here today. our OPSEU SEFPO President, JP Hornick.
Thank you so much for having me here today, and I want to give a shout out to our labor partners who have joined us. Huge credit to the staff and the organizers here who have put this rally together. Local 5115, your leadership is amazing. And we're here all together to send a clear message to the Regent Park Community Health Center management that they are on notice. Community healthcare workers deserve respect, and they don't deserve it just in words. They deserve it in better benefits, in better wages, because you are the heart of this community. Some of you know this, I lived for 25 years up in the Diane Franklin Cooperative Homes over on Bleecker Street. I know what RPCHC means for this community. I know the work that you do, and I know that you are directly under attack because you are the fabric that holds it together. This neighborhood, this community is one of the most beautiful and vibrant communities in the city of Toronto. The folks who live here, who have been systematically pushed out and held down for decades, deserve the supports that you provide. But as workers, you deserve the supports you need to even live here and be able to support the folks who live here with you. It is shameful that this work is going unrecognized. It is more shameful that the management here is giving themselves raises, is giving themselves bonuses. And shame on them for excluding relief staff. I want you to know that whatever it takes, our union, OPSEU SEFPO, is going to be standing right here with you. So will our labor allies, and so will this community. We know what it takes to win. We know because we've won again and again and again. Look at the LCBO workers and what they're doing with Doug Ford. Look at the AGO workers who are here with us again, and they're standing in management. We will fight together, and we will win together. Because when we fight, we win. When we fight, we win. When we fight, we win. Are you in this fight? Yes.
Thank you, JP. Our next speaker is a dedicated advocate for OPSEU members and their communities, works with integrity, knowledge and inclusion on all of the financial decisions of our union. OPSEU First Vice President and Treasurer, please welcome Laurie Nanskaville.
Oh, every day is a great day for a rally. Absolutely. Thanks so much for being here. Thanks so much for supporting our members here and the community. This fight matters because it's valuing the immeasurable impact that all of these workers have on the community and all community healthcare workers. They are the communities the communities deserve so much more of what you provide. You deserve real wage increases, not just the Bill 124 reopener, but real wages that allow you to work in the community and live in the community that you're in. To hear that you haven't had a benefit increase in 30 years is absolutely shameful. 30 years. People could start here and retire here and still not see an increase. And I have no idea why this management system thinks that that is okay. But I know that it's not just about compensation for the workers here. Your employer refuses to address the concerns about program cuts and workplace mental health issues. They've created a toxic work environment and has led to anxiety and burnout. and there's barriers, of course, with that and program delivery. To deliver effective programs, you need to feel psychologically safe in a work environment in addition to having adequate wages and benefits. The work that community healthcare workers do save lives. You save lives. The people that you support have fundamental life and death situations. In this community, you support some of the most vulnerable. Look around. Your community is with you. Other Labour allies are with you, and we are with you every step of the way. Do not be forced into accepting mediocre. We have 180,000 OPSEU SEFPO members that will be with you, and it goes far beyond that. Get what you deserve. We are with you every moment. Solidarity.
Thank you so much, Laurie. Our next speaker is an executive board member for Regent 5 Toronto, dedicated to supporting, advocating education for our members. Regional Vice President for Regent 5, I would like to welcome Colleen Holder.
My members are dressing me and undressing me. They're so good. Hi, everybody. Welcome to Regent Park Community Healthcare Center. We're here to stand in solidarity with our members from Local 5115. So what does solidarity look like? I'm loving it. This is what solidarity look like. We've got members from LCBO, AGO, all of OPSEU, and all of our Labour partners, Labour Council. Wow. Thanks for coming out. OFL is here in the house. We're all standing behind you. We need you to know that always. We're with you. And we're asking for your members from 5115 to stand behind your bargaining team. They need you. They need you to stand in support. They need to know you've got their back. The rest of us have all your backs. You've got to have the backs of your bargaining team to show them when they go to that table that you're going to do what you need to do to make sure they get what they're asking for. They've only asked for 4%. You deserve way more. You deserve way more. The least the employer could do is give you benefits that you can count on. A living wage that you can count on. We don't want you to go to the food banks. We want you to be able to feed your families. Right? And we need you to know that you've got power. There's no such power like the power of the worker, and the power of the worker won't stop. Say what? There ain't no power like the power of the worker, and the power of the worker won't stop. Say what? You've got the power. You've got to know that. Take that power with you daily. If your members on the bargaining team say wear blue tomorrow, what are you going to do? Wear blue! Wear blue. We're going to fight this thing, because when we fight together, we win. We know this. We've proven it so many times. When we fight together, we win together. You've already organized, so you're going to fight! And that's what we're going to be here to help you to do every day. Solidarity, people!
Thank you so very much, Colleen. Okay, our next speaker is a long-time activist, a union organizer, a community advocate, a proud member of the Muslim community in Toronto, is a Secretary-Treasurer for the Ontario Federation of Labour. Please welcome Ahmad Gaid.
Thank you very much for that. My friends, as introduced, my name is Ahmed Gaid. I am the Secretary-Treasurer of the Ontario Federation of Labour. We represent 54 unions and over 1 million workers right across this province. And I'm here to say that I bring greetings and power and strength on behalf of those million workers, of which OPSEU SEFPO is a member of. So solidarity. I'm also bringing greetings on behalf of our president, Laura Walton, and I'm joined here today by Jackie Taylor, our vice president. And we wanted to give a message to you all, to members of Local 5115, that we're here with you. We're here with you from the beginning, and we'll be here with you till the end when you win a fair collective agreement. I know the work that you do. It's important and crucial for Regent Park. You service a vulnerable community, a community that needs the work and the support that you provide, a community that looks like me, and I'm so proud and honored to be joining you here at this rally today. I want to tell you that it's not fair by the management to put you in a precarious situation. I get it. It's only what, your second, your third collective agreement you've had negotiated here? I get it. They might not like unions, but we're going to show them the strength and the power of not just OPSEU SEFPO, but of your local and of the broader labor movement here in the province of Ontario, the power of the Ontario Federation of Labour and the 54 unions. Everyone deserves to have a good job. There's no reason why you should be put in a situation where you are serving a vulnerable community when you yourself might be in a very precarious situation. How does that even make sense? It doesn't make sense. It's shameful. You deserve what you're owed. You deserve better wages. You deserve safety. You deserve dignity and respect. And if they won't give it to you, because trust me, they're not going to give it to you, we're going to take it. Now, I know this looming strike is on everyone's mind, and I hope that the management comes to their senses and comes to the table to bargain fairly and freely. But chances are, you might just be on strike. And the Ontario Federation of Labour is going to be there for these escalating actions. If you have to go on strike, we're going to be there. And when you win your collective agreement, a fair contract will be there as well. Now, I just want to say one thing. It's not just your employer here. We got to talk about a situation, Bill 124. We got to talk about a wage suppression bill, a bill that was brought in by the Premier of this province, by the Conservatives, by Doug Ford. Oh, so you guys are not fans of him either, okay. I get it. You deserve better, you deserve a good job, you deserve good pay, and we're going to be there with you. And if you decide to go on strike because you're forced on a picket line, we're going to let this management know what that sounds like. So let's give them a little taste of what that's going to sound like. If you don't get it, 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 if the workers 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 don't get it, what are you going to do? 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 Now, I want to talk about what that means if you go on strike. It means no one in and no one out. Let's let the management know that too. No one in. 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 This crowd only gets bigger if you go on strike. I hope they know that. We're with you. Solidarity. 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 solidarity, my friends.
Amazing. The lineup just keeps getting better and better. I'm speechless. Next speaker is QP Local 79 Local President, representing 20,000 workers from the City of Toronto, Naz Yadoli.
Good morning, everyone. How are you feeling? My name is Naz Yadolahi. I'm the new president of QP Local 79, where we don't represent 20,000 workers, we represent 30,000 workers in the City of Toronto. I am one person here today, but I want you to know that you have the support and the backing of all 30,000 workers in this city and every single one member of every labor organization in this entire province. You know what I find interesting is when management or employers talk about how important it is to provide critical services, how healthcare workers were heroes during COVID, how people bound together to provide these critical services. How can you possibly be serious about something like that when you can't even take care of your own workers? If you are not committed to providing decent wages, benefits, and living conditions for the people that provide those services, how can you possibly be taken seriously when you talk your empty rhetoric about providing services to community? I know it's hard for these workers already, because guess what? Some of them are our members. They work here, and then they walk over to the community centers where they work. Workers should not be working multiple jobs to make ends meet. I would like to know how many of the management members work multiple jobs to make ends meet. Don't tell us you don't have money when you're filling and lining your own pockets. When we stand together, we win. But the power belongs to the worker. When we bind together, that is our strength. There's this thing in the labor movement where we think that labor should only tend to labor, that issues are only about bargaining. No. I want to ask us here today, let's be bound by our humanity. Let's be bound by our struggle for justice, equality, and fairness for everybody. Whether you are part of a labor organization, or let me just say, so much of this city is run by these incredible grassroots organizations who have no connections to labor. Let's be bound together by our joint venture for justice, equality, fair wages, fair living conditions. I know that a lot of folks have done a lot of really wonderful chants, but here's one. It's simple. I say worker, you say power. Worker! Power! Worker! Power! Worker! Power! Worker! Power! Worker! Power! Worker! Power! My friends, if this continues, you will see so many more Local 79 members here standing side by side and other members of the labor organization. Thank you.
Okay, our next, and that was absolutely incredible, and I think we all can say very clearly that we are very supported in the greater labour movement, so thank you. Our next speaker is a union organiser from many years, fights equality and justice for all workers, is committed to growing the labour movement and fighting climate justice for future generations. President of the Toronto and York Region Labour Council, please welcome Andrea Babington.
Okay. All right. So we're going to start off, and we got to make sure that they're hearing it loud and clear, because we mean business. You see the weather out here and we're here? Many more of us is to come. When healthcare workers are under attack, what do? Healthcare
unusual. If this is your first time coming out here in solidarity, or any worker, this is not unusual. This is how the bosses test us. And this is how we start off signing off in solidarity, that we're not going to roll over and play dead. We're going to kick you where the sun don't shine. Toronto and York Region Labour Council stand and fight side by side with over 220,000 members. And some of those members are right here. And so we know why we are in this union, because we have to stand together to take on the boss. We hear it over and over in the pandemic, over and over. Liar like your employer here, who want everybody to believe that the crisis that we were in during COVID, that they hail healthcare workers. But the proof is in the pudding. If they're not willing to pay for the service, then we know for sure that that was just them trying to make themselves look good and to sleep better at night. Comrades, I want to say this to you. For over the years, coming out of a sector and watching workers years by years, trying to fight the boss for what they deserve. We're not asking for anything more, just what you deserve. What we do see is employer like this that stay at the back and count how much money they can make off your back. But they're not willing to pay their fair share. And this is why we're here. Imagine co-workers even before you for 30 years come to work and walk away with no sign of respect, no benefit, no decent wages. Shame on them. Imagine if you knock on a lot of those workers who came through this place many years ago and already retired. They wouldn't have nothing good to say about this employer. No one should come to work and go home at night worrying about how they're going to retire. No one should wave goodbye to their co-workers and still worry about pension. No one should finish work and on the day of their pay, they're still wondering how they're going to put food on the table. This is what they want. So I'm here to send that message alongside with you that this fight is our fight. This is our fight like yours. This is all of us committing ourselves that as long as it takes, we're going to show this employer that we're not going to stand and look at the other side. Because workers deserve respect. You deserve respect. They might think it's just you wanting more, but it's not. It's you coming to work every day and putting everything in you to make sure that the people that you serve get the best care that they deserve. If you're unhappy, if you're not paid properly, if you have to run somewhere else for another job, how can you concentrate on the service that you're giving to these people? It's time that they understand that it's not about them just lining their pocket. It's a business for them, but this is a service that you do and you proudly do it every time you come on the job. If you have to take this employer on any further, and if this employer don't want to listen, if this employer want to test you to see if you're going to run away from them at this bargaining table, guess what? Our battleground is in the street, and we'll take this fight in the street if we have to. So when they're ready, they need to let you know, because we are ready to take on this fight. We are not going to let you take anything less than what you deserve. Sisters and brothers, let's keep this fight on. Stand strong. Solidarity, sisters and brothers. We're going to be here with you one day longer. One day longer. One day stronger. One day longer. One day stronger. One day longer. One day stronger. Solidarity.
Okay, so just before I announce the next speaker for today, I just want to do a quick shout out to our sector chair for community health workers in for sector 17, and executive board member Lucy Morton, who is here today. So thank you so much, Lucy. Okay, our next speaker is a community organiser and co-chair of the Regent Park Social Development Plan. Please welcome Waleed Kugali. Thank you.
Thank you. I'm going to start off with a chant and I'm going to end off on this chant, and I hope you all remember this, okay? All of us or none of us? All of us or none of us? Okay, my friends, comrades, and residents of Regent Park, and friends from our labor movement, I'm so happy that we have leaders of our labor movement right here in solidarity with our really important members of our community. We gathered today not just to discuss a strike, but to acknowledge the pulse of our community, the vital services that touch the lives of each and every one of us. The potential strike at the Regent Park Community Health Center highlights more than a contractual dispute. It underscores the profound impact on essential services provided to our community. I want to actually give a shout out to Deanie Peters from the Regent Park Community Health Center. Deanie's been supporting the Regent Park Social Development Plan and so many other members of the Regent Park Community Center. Our health workers, those who have stood at the front line, are more than just employees. They're the custodians of our health and well-being, and that means the health and well-being of our community. Day in and day out, they offer crucial, sometimes life-saving services to those in need. Their dedication and expertise are the backbone of Regent Park's vitality, ensuring that no one is left behind in times of need. But let us remember, my friends, that fair compensation and healthy working conditions are not mere benefits. They're fundamental rights. These are essential not just for the sustainability of our communities, but for the continuation of indispensable services that many of my neighbors rely on. To the management of the Regent Park Community Health Center, an inflationary increase in wages and access to enhanced benefits are not luxuries. They are necessities. They're necessities that ensure our community continues to benefit from the unwavering commitment of these invaluable professionals and members of our community. In standing together with our amazing healthcare professionals and members of the Regent Park Community Health Center, we recognize the invaluable contributions they make to the health and vitality of Regent Park. It's the least we can do. It's the least we can do to support those who have dedicated their lives to serving our community. Let's ensure that our collective voices are heard, their needs are met, and their dedication is acknowledged. Together we can build a stronger, healthier Regent Park. Let us support all the staff at the Regent Park Community Health Center, not just in words, but in action. For ensuring their well-being, we safeguard the health and future of our community. So, I'm going to end off on this chant. Health for all, okay? It goes like this. Fair pay, fair play for those who care night and day. Fair pay, fair play for those who care night and day. Fair pay, fair play for those who care night and day. Regent Park, hear the call. Support our workers one and all. Regent Park, hear the call. Support our workers one and all. Regent Park, hear the call. Support our workers one and all. And finally, it's all of us or none of us. It's all of us or none of us. It's much for coming out today, and let's keep on the pressure to ensure benefits and inflation increases that are bare minimum that these amazing members of our community are given. Thank you.
And I just want to give a quick shout out to another Region 5 Executive Board member, Julius Ascott, who's here today. Thanks, Julius, for joining us. Our next speaker is an anti-poverty activist. Please welcome Marek German.
First of all, I want to thank the workers of Regent Park. I've known these workers for a long time. I was in the territory for maybe over 40 years. Thank you, workers. In this area, this was an area of battle. This is an area in Toronto where battles began to spread across the country. Many billions of dollars and millions of dollars have been spent on poverty in Canada, right across Canada, because of what happens here. And because of the workers who are here. They've been here for a long time, pretty long time to be left without wages. A place like this must be conscious of the fact that you can destroy people by taking away wages, by not giving them homes. We have the right to have everything. I give you thanks. It is the responsibility of the administration here to pay your wages, to look after you. The old cry of housing and food, the right to housing and food, the old cry is here today. Just like and the great workers. I'm the only one allowed to speak about this today. Josie Ricardo. Josie's not part of the union. Josie had been here for many years. She brought women into the streets here to fight against racism, against sexism, against rape. She took people into the streets. All these streets were filled with people that Josie brought. But where's Josie today? Is she here somewhere? No! She was near pension, and she was let go. Well, this ain't over. This is surely not over. The people in this area thank the people here, and we go on, and of course, we will win. 30 years is a long time.
Our next speaker is a Shelter Housing Justice Network member. Please welcome Lorraine Lamb.
So I'm not gonna lie, I could really use some union members waking me up every morning with some inspirational chants, because get out of bed easily. So I was looking on the Regent Park website, and it says the Regent Park CHC, quote, supports people who live and work in the area to improve the health and well-being of the community. It sounds really nice, but what's striking to me is that it's a pile of lies. I don't actually think management is really concerned about the wealth and health and wealth. Okay. I'm really struggling today. I'm so sorry. Of the community. Okay, we'll try again. So I'm speaking today as a frontline worker, and I got to work here for a year on the ground floor. My work in the community was always around supporting people who are unhoused or precariously housed, people who are silenced by systems, harmed by powers and systemic oppression. And what's always really striking to me is people are always like, oh my gosh, frontline work is so hard. because they assume that poor people are the problem. Except the hardest part of the work is actually the systems we're forced to navigate, the lack of resources, and actually the hardest part of the work is trying to work with management who don't have our backs. Not just managements who don't have our backs, but managements who actively cause harm in the community, both staff and non-staff people alike. And when your management doesn't have your back, that's the hardest part of the work, and that's what causes burnout. And so when I started this work in 2006, I had always heard about the incredible work that Regent Park was engaged with. Healthcare, social work, advocacy, systems navigation. And when I started on the team, I was so excited because I was finally going to get to work with Cheryl and Danielle and Fiona and Calvin and Anne. Like, I was that weird internet girl who was like, they're so amazing, and now I get to work with them. And actually, like, nothing about that has changed. In fact, I met even more people who work here, and my admiration for the staff team here only grows. And I know for a lot of years, Regent Park's reputation as a community-centered, holistic, caring, dedicated staff team who is committed to the health and thriving of this community was such a reputation to be proud of. And it's actually the staff who keep this going, and it's their unwavering commitment that keep this going. And when I started here, I very, very quickly saw that it was the staff who keep it going, and they had to constantly fight against senior management who were largely disconnected and actually causing more harm to this community. I saw that on paper there was a decision-making and communication framework that was, quote, developed to allow for a sharing of diverse viewpoints where employees could make decisions that affect their work. Like the website, it sounds fantastic, but instead in practice, decisions were made unilaterally without staff input. There was no transparency. Staff would hear about decisions after the fact, and they wouldn't receive any information. There was no process and no space for collaboration. They implemented monthly town halls, and we all showed up, provided lots of feedback from our time, but we never got follow-up to the things we said. So what was the point of these performative monthly meetings? Programs were restructured and cut without any communication or consultation with staff, and there was no conversations with people directly impacted. For instance, what actually happened to the HIV care for those without status? And what happened to all of the gift cards and the money that was allocated for people who are unhoused? Where did all that go? Also, they can't fire me because I already left. I also saw decisions about budgets and program cuts that were made without program managers or staff involvement. There were times when different departments had questions around funds and budgets, and our own managers didn't have answer because there was no transparency from senior management. Resources were withheld from programs that serve some of the most vulnerable community members. Again, what happened to all those grocery cards that were supposed to be bought for the people who are living outside because of gentrification? No response, no trust. And while I was here for that short time, the community health director was fired, along with the key manager, Josie, who was fired after 30 years, and the only notification we got was a Monday night email at 10 that said staffing update. Today was Josie's last day. Thanks for her 33 years. End of conversation. This destabilization was felt across the health center and the community, and when we asked senior management about it, they said, well, Regent Park's gone through changes before, so we'll make it through this one. So it appears that the team is also just viewed as disposable. And so then you had a staff email list of 175 staff members, with a number of whom who voiced their concerns over a staff email list because there had been no other avenues, and senior management decided that they would revoke email privileges instead, creating a culture of silence and censorship. So they say they want our feedback, but when people ask questions, they just say, nope, block, no more email privileges for you all. The way they go about it is to limit and restrict communication and actually limit the ability for staff to come together with shared solidarity and concerns. Those are just a few examples of what happened in the year that I was here. And meanwhile, staff continue to work in good faith with the commitment to hopefully see things improve. especially around psychological safety. You know, I know we talk a lot about wages and benefits, and sure, we all want more money. Like, they're not even asking for an inflation match. It's just like pennies. But yeah, we actually also want psychological safety in our workplace. And instead of improving that, senior management has turned this workplace into an unsafe and toxic work environment. But yet, the staff are still here and they're still persisting. They're holding down for the community the best that they can until it reaches a breaking point, and I think we're here. Because staff aren't just robotic laborers. They are humans too, and they're also feeling the burdens of life. At a time when we talk about the rising cost of living and how egregious it is that we're all paying $5 for a cauliflower, senior management is refusing a wage increase so that workers themselves can thrive. Remember when the website says that they care about the health and well-being of people? I don't see any of that here. Also, where's that sign that said like benefits have been frozen for 30 years? That's bananas. We all need therapy to process what's happening here. Meanwhile, senior management has given themselves a wage increase. And I know that it was not a light decision for the team to vote to strike, and there is no doubt in my mind that this weighs heavily on staff and causes more distress. But how things are going have hit a breaking point, and things must change immediately. Senior management must make immediate changes to wages and benefits and transform the safety for this team. As I mentioned, staff here have held down through the changes in the community, the displacement, the gentrification. These are all external factors that have not changed the commitment of the staff team. It is the internal senior management that's making it impossible for this team to continue their vital work. I will note that without this team, this center has nothing. And I will note that my letters to the board have been met with silence. And so I personally support the voices of this unionized staff team wholeheartedly. You know, at one point everybody like banged their pots and pans because they love frontline workers. Where is the banging now, right? I hope that senior management, who's not even here, will stop their empty words of performative hypocrisy and listen to what the team is saying. Workers need to be heard and they need to be protected because they are part of the tapestry that weaves Regent Park together. The life-saving and the thriving work that happens at this health center cannot happen without the staff team. Anyways, y'all ever been to like a concert, right? Like the concert's great until something goes wrong and then everyone's like, the AV guy messed it up. Or like you're driving a car and the car is driving and all of a sudden your engine breaks and you're like, oh shoot, I forgot to maintain the car. So the car is falling apart and the health center is not going to thrive without the workers. And so senior management now has a choice to make about whether they will choose to continue to cause harm or will they contribute to the thriving of Regent Park's neighborhood. I hope that they make the right choice.
Thank you so much, Lorraine. And I'd like to invite a union steward from OPSEU 535. Art Gallery of Ontario is representing 400 workers. They're too on a countdown to imminent strike action March 25th. These workers ensure the art and the programming is in public access and literally keep the art gallery lights on. Please welcome Megan Christo.
5115, are you ready to fight? 5115, are you ready to fight? Your siblings from down the street, the weirdos, I'm sorry, we're here, but we're here to support you because much like you, we are being forced out on the street, but it's Monday for us. My Vice President Charles is here, and we are here to support you. The work you do in our community is life-changing and life-preserving, but the employer has pushed you to this point, okay? You guys didn't do this. They did this. The employer is the reason why we all have to be out here today to show our collective strength, because we don't do this for ourselves. We do this for our families and our communities. At the Art Gallery of Ontario, we also provide services to the communities, and we understand that we can't exist without you. We know that your clients visit us, and we know that our folks visit you. Your employer plays the same games as ours. They use pretty words and false promises to look shiny and palatable to the outside world. Let's take a cursory look at their website as mentioned earlier. Removing barriers and improving lives. You, as workers, have done this, not them. Has your employer removed barriers for you? Have they improved your life? Yeah, that tracks, as we say. Regent Park Community Health Vision. Equitable health outcomes and social justice for the communities we serve. I ask you again, has your employer treated you with equity and social justice? With a turnover rate of 22% of your staff in 2022, in 15 in 2023, I don't bloody think so. The lowest bar for your employer to achieve is adequate wages and safe working conditions, and they can't manage that. You have all voted 100% to go on strike, and you must continue to stand strong together. They cannot break you down if you're together. We are in this fight with you. We are all going through this. And I know as a young worker, I still, and like I'm sure so many of you, have 30 years left of this to go. And instead of, oh, just go find a better job, no. We are not doing that anymore. We are staying here. We are fighting. We are making this better for us, for the community, for our families. Keep fighting. We are with you. Thank you.
Wow, what an amazing, incredible hour we've had. We're almost going to wrap things up, but we have a really important message that we want to share. One of our clients wrote a letter, and he couldn't be here today. He's in hospital. So we have one of our staff who's going to be reading that letter out. Matt?
Thanks, bro. Welcome all friends and supporters of the RPCHC community. Good afternoon. I am a frontline worker at Regent Park Community Health Center, and I have a letter from a dear client of mine I would like to read to you today at his request. I regret, unfortunately, that he is unable to grace us with his presence. However, I would be honored to read it in his place. He has given me his express permission, very proudly I might add, to tell you a bit about himself. His name is Gerald Banks, Jerry as he's known by his peers. A few months ago, Jerry suffered a heart attack while in our care. We provided him with emergency response, supporting him and monitoring him until Toronto paramedics arrived on scene to render advanced life-saving measures. The situation was tense, and for a moment, we were all very worried for him. We are all grateful to have him each day with us, as he has become a well-respected and honored member of our health center. I will read you his letter now. Dear Edward, Paulos, and Miriam, I'm writing you as a staunch supporter and advocate of the remarkable staff at RPCHC. With the recent realization of the current wages that the staff members are receiving and unable to attend any physical demonstration because of my current hospitalization, I've been moved to address the matter of the utmost importance. RPCHC, established in July 1963 and commemorating the 50th anniversary on July 14th, 2023, holds a significant place in our community at 465 Dundas Street East. The dedicated individuals who work tirelessly with RPCHC continue to provide essential services with unwavering dedication and compassion. Often, under challenging circumstances and for what I believe to be inadequate remuneration. My personal involvement in many over the past 30 plus programs offered by RPCHC have granted me insight into the invaluable service they provide, ranging from social work and more than one occasion. Such critical services demand not only our appreciation, but also fair compensation for their skilled individuals providing them. I urge you to consider the invaluable contributions of RPCHC staff members and the essential role they play in our community's well-being. A 4% raise would not only recognize their hard work and dedication, but also ensure their continued commitment to providing necessary high-quality care and support. In light of recent developments and the potential impact of staff dissatisfaction, I implore you to explore all options to address this matter promptly. The possibility of a strike looms as a dire consequence, threatening the continuity of care and potentially endangering lives, a risk that our community cannot afford to take. Your attention and in preparing to this matter is greatly appreciated. Thank you in advance for considering my considerations and taking action to support the indispensable staff at RPCHC. Sincerely, Gerald Banks. Frontline staff serving our beloved clients who access our services at Regent Park Community Health Center share their lives with us at their most vulnerable moments and face trauma with those who we care for and support the most each day in our work. And now we share their and our voices with you. Don't shut us down and don't shut us out.
So much, Matt. That's where it really hits you in the feels there. So we really have appreciated everyone to come out today. I just want to, I feel like we've done a few chants, but I really want to get a couple of quick messages out. When I say what do we want, you say respect. What do we want? Respect! When do we want it? Now! What do we want? Respect! When do we want it? Now! Now this time, what do we want? Fair deal. What do we want? Fair deal! When do we want it? Now! What do we want? Fair deal! What do we want it? Now! The bargaining team's going into mediation tomorrow, and that's going to be a bit of a make or break day for us, so wish us luck. We're fighting hard. Everyone who's received a little flyer, make sure you fill out the digital action, write to our executive, our management, our board, tell them and demand that they respect the workers and they give us a respectful and fair deal. Thank you.
Don't forget to like, comment, share, and subscribe to our YouTube channel and check out all of our social media platforms. For more information, check out our website.